Good afternoon, everyone. My name is Tyler. I'm the operations manager for Login Clinics, and thank you for allowing us to be here today to speak to you about mental health awareness. I am a paramedic by trade, and I have been for the past 6 years. And in the field, of course, they teach us many different things to help an individual. One of the cornerstones of that is CPR. But I do feel that mental health first aid is another cornerstone to that to provide overall better health and well-being. Some of the tools that they teach us in the field to be able to identify a mental health crisis is how to identify, how to understand, and how to respond to an individual. So the first step to mental health first aid is being able to identify. You want to be able to identify the mental health warning signs of an individual. You can see this by possibly a decrease in productivity at work, not being able to complete assignments in a timely fashion, if they are constantly tardy to work, if they're calling out on a regular basis, if there's any increase in conflict with other team members around them, or if they're just isolating themselves from work, could all be signs and symptoms of a mental health crisis. So the second step to understanding a mental health crisis would be to assess the risk of self-harm or suicide of an individual. Is the employee making threats to themselves or others? Is there any evidence of physical harm? You can witness this by seeing if there's any lacerations, abrasions, or bruising to the individual. Sometimes that's difficult to do, considering we have lots of different PPE that we wear. But if you're in a close contact with an individual, sometimes you can pick up on some of these things. Do they appear agitated, aggressive, or hopeless? Are they withdrawing from people around them, their family, friends? Is there any drug or alcohol use that you've noticed or picked up on? Are they acting reckless or engaging in dangerous activities? This can tie into the hopelessness. If they feel hopeless, then oftentimes they will not take the proper safety precautions whenever they're on site. The second point to mental health first aid training is understanding. And able to understand, we need to be able to listen. And in listening, we need to be able to do that without passing judgment on the individual. We want to make sure that we're having a meaningful conversation and that we're not interrupting the individual when they're trying to fill us in on what's going on in their life. This will provide them with acceptance and respect. We want to make sure that we're presenting open body language, not folded arms, not leaned back in our chair, but to show them that we are engaging and that we are interested in what they have to say. We want to make sure that we have comfortable eye contact. If we're constantly looking at our phones or our computer screens or TV, that shows the individual that we truly don't care, and this is just kind of taking up some of our time. The third point to mental health first aid training is providing reassurance. So that's the response part of the training. In response to this individual, we want to be able to, of course, approach the conversation in a respectful manner. A lot of this information that the individual will share with you is going to be very personal. If this is events that has been leading up from their childhood, they could be confiding in you and with things that they haven't talked to anyone else about before. So we want to make sure that we are being respectful in that manner. But we don't want to blame the individuals for the circumstances that they're in currently. This might be hard to do at sometimes, but we need to be able to respond in a caring and loving manner. We want to be able to reassure them that they are not alone and that you are there to help them. So the second step to being able to respond to an individual is going to be able to provide them with resources. We have numerous resources available, and one hotline in particular is a helpline for the American Foundation for Suicide Prevention. That's a great resource that's open 24 hours a day for someone to be able to speak to an individual that's experiencing a mental health crisis. There's also local crisis centers. Typically you'll find these close to hospitals. There is one up close to the UVA, and we do have that contact information at our Login Clinic site up at UVA. There's also healthcare providers. If that individual does have a history of depression or mental health, contacting their healthcare provider can be very beneficial to them. And most importantly, though, if they are showing signs and symptoms of suicide or wanting to inflict harm on those around them, then you need to utilize 911. In summary, you want to be able to identify the signs and symptoms, understand by listening to an individual, and respond by encouraging and providing the proper resources. So thank you for allowing Logging Clinics to be here with you today and talk to you about mental health first aid. If you would like to reach out to me, you can reach out to me on LinkedIn, or if you would like to send me an email, you can contact me at tyler@loggingclinics.com. Thank you.